Hello, welcome again. This is your friend. We want to talk about constipation and pregnancy. What do you need to know? Maybe you are a first-time pregnant woman or something, and you are being constipated. Constipation is a very common symptom that people will experience during pregnancy. So just if you are experiencing it, it's not an exceptional. And we have some home remedies such as drinking water, getting enough physical activity, minimal exercises may help relieve constipation. And at times, it might warrant a visit to your doctor. And I want you to know that some women have constipation at an early stage of pregnancy, while some it does not affect other women until maybe third trimester or second trimester, much later on. So we all have peculiarities in the way our body functions. So in this video, I will be explaining why constipation is very common in pregnancy. It's very common in pregnancy, and of course, to discuss safe treatment and different home remedies that women can use to relieve constipation in pregnancy, that they can use to relieve discomfort in pregnancy. You understand? So if you are going through that, like I said, you are not all alone. A lot of people are going through it. Just only need to speak up and, of course, seek for help. Is a sign of strength, and you'll be able to get something out of it. What are some of the causes? The cause of constipation during pregnancy depends on the stage at which it occurs. You understand? It depends. And some of the possible causes of constipation in pregnancy include hormone changing. Hormone levels in early pregnancy, of course, most of the time can cause the intestine to slow down. There is something we call peristalsis, the movement, you understand, the way the intestine moves. There is the slowdown of peristaltic movement of stool through the bowel during pregnancy. And of course, this delay, what does it do? Increases the amount of water that the colon absorbs from the stool. And when that happens, it makes the stool to be more solid and difficult to pass through. You understand? So instead of going straight, the movement is with peristaltic movement that is faster. It becomes gradually, it will becoming imparted, just piling up like that before it happens. And sometimes it might be prenatal vitamins, all those drugs we use to prepare our body and the baby's body. They are full of iron, most of them, because the baby needs blood, we need blood too, and it's a crucial mineral that can sometimes be deficient during pregnancy. So most of the time doctor recommends it, but what does it do? One of the side effects is constipation, and at times the stool will be so hard and black. If you see black stool and just like tiny sometimes, it is the reason for that. Then at times it might be the pressure from the uterus. In later pregnancy, when the pregnancy is growing, the uterus can put pressure on the bowel. The bladder and the bowel, they are just below the uterus, making it harder to move stool through the intestine. It might be. Then, of course, in addition to infrequent bowel movement, when the movement is not fast as it's supposed to be, it can lead to constipation. And constipation at times can cause bloating. Just feel heavy, stomach discomfort, hard dry stool. At times it's very painful to pass. Like some people, they might have early hemorrhoids, even in pregnancy, because of this thing we're talking about. And of course, it can also result in a feeling that not all the stool has passed. You just feel heavy just below, down there. Then constipation can be particularly uncomfortable during pregnancy. It is not funny at all. Constipation is not funny at all. It can be so, it's not funny. Then apart from that, home remedies, uh, what what can we use as home remedies during pregnancy for women? Number one thing you want to use, women can often relieve constipation using gentle home remedies that we've been talking about. Number one, you can take fiber. Fiber will help your gut. Will assist your gut, and it becomes easier. You understand? To to pass through. Taking fiber supplements. We have fiber supplements, we have fiber foods, eating more fibrous foods such as fruits, vegetables, whole grain can increase the number of stool that you pass, and this will facilitate their passage through the intestine. Adults should eat between 28 and 34 grams of fiber according to the doctor. Even when you are not pregnant, we all need fiber because we are supposed to make stool almost every day. As you are eating, you are supposed to. Then, of course, fluid is very, very important. Drinking enough water is important to keep soft stool and make it easy to pass. You understand? For example, if a person feels that water is not helping, what do? They can try and do something. They can add clear soup, and they can add teas, and of course naturally sweetened fruit or vegetable juices to their diet. And you have to be in pregnancy. There should be activity. Being active helps to move through the intestine. You understand? So you have to get regular exercise with a doctor's approval, which can help relieve constipation. And if exercise is not a priority or possibility, you can try to fit in a gentle walk, just a brisk walk every day. In fact, there's something we call probiotics. Millions of healthy bacteria live in the gut, and what happens? And it helps function correctly. Probiotic may help repopulate the gut bacteria with healthy strains that encourage normal passage of stool, and encourage normal regular bowel movements. I've told you one of the reasons is because the bowel is not moving forward, so it is not moving as it should. Food high in probiotics like yogurt, kimchi can help you. If other home remedies treatment do not work, you should see your doctor. For women taking prenatal vitamins that are high in iron, you have to see your doctors, because so that the doctor may recommend something like trying another vitamin or something that contains less iron, because you need iron in pregnancy because of blood. So the primary medical treatment of this is laxative, which makes it easier and more comfortable to go. But for pregnant women, it is not always advisable. Although laxatives are available over the counter, it is very vital and important to check with your doctor, so that doctor will be able to tell you which one is safe, which one is a no-go area, and all that. Limited information is available on the use about using laxative for constipation in pregnant women. Some of this medication, you should talk to your doctor during pregnancy. And of course, finally, women can usually use the following during pregnancy: bulk forming agent, which like fiber by adding material to the stool and helping it to absorb more water. Then this one will make your stool to be larger, softer, and easy to pass. So of course, some laxative can cause cramping. So that is why you should run away from it. And of course, the stool softener that doctor usually recommend is called the Docusate or Coles. Lubricant laxative too are there. They can add a slippery coating, and that one is easier for you to go through. You can use glycerin suppository, but finally, it is very, very important you talk to your doctor when you are pregnant. See you in the next video.